Hello guys and welcome. I'm Dr. Patrick Price and I've had a lot of requests to do a couple different things. These will be in pieces, but today I'm going to show you about shoulders and upper body. A lot of us want to get more of a upright stance as far as a more of a erect spine. And it's not just doing the military shoulders back. It's going to be, as you'll learn in Qi Gong, it's going to be holding and lifting. And we're going to discuss first today, like I said, these will be in segments, but I'm going to show you first the Qi Gong because this can be a daily morning practice. Even if you just spend 5 minutes in the morning, guys, that's all you'll need to get your back and neck taller and straighter. All right, so follow with me. First stance in Qi Gong is always hands into the earth, as such. And then from here, lifting your body from the center, lifting up. It's not shoulders back, it's lifting up. As you lift up like a string, you have holding the head. And so from this position of lifting from your center and your head being tall spine, you drop your shoulders down and relax. Now in Qigong, they always want to open up. They call the Qi here. Open up from here. So this should be your stance. Tall, string lifting up, shoulders down. Got it? Now from this position, the very first movement today is, and also watching your feet. So notice my feet can be out, can be in. Think of it like you're in a boat, paddling a boat, like a canoe, and you need to make a V with your body. A little bit of a V and slight bending of the knees. So just getting this stance is a practice every day, just holding the stance itself. So the very first one, we're going to lock the fingers together, as such. And from here, this is done slowly, lifting straight up. At the face, turn over, reach up to the sky, lift up on your toes, and open. Notice how slow I move down. And up, and down. I'm just going to do 3 at a time. We've got several things to show you today. Up, and lift. Notice I go on my toes. As soon as my heels hit the ground, it opens. And then I let it go. See how I do a slow motion of letting it go? And I go back into this position. So that's your very first one. If you just want to do this one every day, the number is 9 times. Do it 9 times every day. Anytime you lift your hands over your head, you're pushing blood back into the back of the skull. The little capillaries, the very small arteries. You're preventing stroke by doing this, guys. A lot of people have that head stance out here. We walk around like this. We try to do this, but it's going to be from the center. Lifting your center is going to help you lengthen your spine. Just walking and even sitting in your chair, sitting in your car, learning to keep lifting your center is a daily practice, guys. This is how I got rid of my low back pain. Now from here, the very next movement we're going to do is going to be the clock. And this is especially for your shoulders. Those of you got a shoulder and you're having trouble lifting it, any kind of angle, and it's really painful, think of like a clock, a circle this way. You're going to take your thumb, rest my left hand here, and come and let your hips slightly turn with you. It's a whole body motion. Thumb comes up, and I'm reaching like I'm reaching out from the body. And I keep reaching to the roof as I turn the hips and roll the hand, see the hand roll over, and the thumb comes down. Thumb secures the shoulder joint. And some people won't be able to lift very high in the beginning. Maybe some of you are older, got arthritic shoulders. Maybe this is as far as you can make it. You can just come across the body and over and down. And that's fine. Don't force it. So we're going to go up, reach, and keep reaching and down and around. Notice how slow it's done. Even here, I'm pushing down into the earth, but I have a tall spine. One more time down. Now as this one comes to its resting place, I'm going to take the other hand and go lifting in this direction here. Notice the tall spine I have. I'm focusing on not leaning towards anything, keeping that tall center of the body. Reach, and then reach here. And you feel your lats and your ribs and all the fascial and muscle areas here begin to stretch as you reach. Thumb down, secure the shoulder. Now once you get better at this, you're going to do the actual clock motion. So as I come up and turn, the other hand's going to begin to do its motion up and down. Notice where the thumbs are. Up and over. And as I finish the motion, let the hand come back down to my resting point. Good. Back in the position of tall spine. So those are your first two motions. Next one is a little more difficult, but I'm going to show you today. It's the cup and the saucer. As your hand is out, it's like you're holding a cup of water. So from this position, you're going to put it like you're putting in your back pocket. You're still holding the cup as if not to spill it. Putting it in the back. And as you put it in the back, notice I'm going to turn the hips. Turn hips and let the cup come around as my hips come around, and reverse my hips. So watch here, back, and around. Notice the hand comes over the head. This is a more difficult movement, so don't do this and try to get away from it. That is not the correct motion. Around and over the head. Notice I'm not spilling the water. Same thing here. As the hand goes in the back, you're going to feed it to the back and let your hips turn with it. As you turn, the hips reverse it around and back around. Good. Now, you think you got it? Roll them both over. Let them be loose. One goes in the back, it goes around, the other one goes in the back, and you begin the motion with both hands. This is how you really have good flexible shoulders to all the days of your life. And back down again. And as I finish, I'll let go. Back into the earth, tall position, shoulders down. There we go. Now, as I go to finish, I'm going to let go this way and step away. Those are your 3 Qi Gong to practice every day, but use just one of them and practice one at a time, guys, until you begin to master it. You tend to feel more flexible, feel like you can do it at ease. The very first one, you cannot fail at this one. You can only fail if you just don't do it. Try it once a week, twice a week, and then eventually you're doing it every day. The next step, find you a stick. As we call this in martial arts, this is a jo. It's a 4-foot staff. You can take an old mop or broom, anything you got, just unscrew it off the mop, and now you have your jo, or your 4-foot staff. So once again, we're focusing on the shoulders and the upper back. I want to get myself from having this hunchback like this. I want shoulders up and down, but it's going to be by creating this tall center. The center of your body, where your belly button is you're going to create a tall center of your body. So take your 4-foot staff, go to the ends, and notice I'm palm down. Okay? Take it up to the side and around, and slowly go where your shoulders let you go. It may not let you in the beginning, and some of you have a lot of pain. See, I'm going around, just go around the clock. Now, some people are really flexible in this position. I've had to do this with injuries I've had. So many times around, and then reverse it. And reverse. Just around the clock, right? So once you're here, you can always take it to one shoulder that feels more stiffer than the others and take it right across your shoulder blade in the back. See this? And then hold and make yourself tall. Give yourself a little tension to hold it. Notice I'm tense and tall. So I'm holding this shoulder in a straight position to teach my body where my shoulders should be. You see? Back and hold and lift. Lift your spine. Back and hold and lift the spine. And back. So there's one there, guys. Now here's another one for you. As you take your 4-foot staff, go to the bottom again. Now this time, change the hand to thumb up. Thumb here, and lift. Push with the bottom hand. Maybe your shoulder kind of hurts about here. Relax the shoulder. Lift it. You can anchor it here on the hip. And then turn the hands and go the other way. This is the easiest way to first do this, guys. rolling the hands over and lift. Now if you just want to go one side at a time, that's fine too. Lift and hold. Lift and hold. And then eventually you can do what? You can lean with it and really feel all those fascial areas loosening up. So now palms down on both sides. Same thing. This is a little more stress on the shoulder than the other way. But now it gives you an easy flow back and forth. Easy flow back and forth. And once again, I want to lean a little bit with it. But as I said in the beginning, turn your thumb up. Thumb up is a less stressful position on the shoulder itself. And then lean with it. So here's your morning. Just rock it and lean. Rock it and lean. Very easy exercises, guys. These should not be stressful to your body. And once again, you're never going to force anything. And since I actually am a doctor of chiropractic, this is what I do every day with the patients. So I'm not just a guy who just saw a video on this and showing it to you. I've done these things all my life. I first did these as a martial artist. Now I'm doing it as a doctor, showing you how to prevent injury or heal yourself from trauma. Now let's change from that shoulder position. And let's think about what's connected next, the elbow area. And you got these two muscles, the supinator and the pronator, that turn the elbow as such. These can be part of the shoulder. Shoulder, elbow, always connected. Back and forth. As the patient was saying yesterday, you look like an airbender. Maybe we're airbenders, I don't know. But here we go, back and forth, relaxing and relaxing. But you want to lock the elbow, not forcing it. And take your other side, same thing. Now these we can always take to an extreme level because of the martial arts side, but those out there watching, I just want to make it a very basic exercise for you. All right. You want to get the back of the forearm, the extensors, you can do the extensors. You want to do the form exercises here, you can go adductors. And then here in the front, so just think of front of the forearm, back of the forearm for those who aren't trained in any medical background. And just holding the end of your staff. Got it? Now those who want to be a little more fun with the Joe, I can't help, excuse me, I'd always show you a little more. Palms up, right? To the side, the top hand comes down. It looks like a windmill, right? So it's done very slow, very slow. Hand comes over, and it comes over, right? Until you have a little more fun with it and learn to just move your staff. This is great for reflexes. This is great for your forms, coordination. This is called anti-aging. Got it, guys? So your Joe staff, your broomstick, your mop, whatever you choose, there it is. This every day you should have this in your house. An easy toy to make your day a better day, guys. Now, looking back at the shoulders again. Everybody should have one of these in their house. There we go. So from here, we're going to look at the shoulders once again. Now, this is a shoulder injury I had just recently, so this is one way I rehabbed it. You can always go to the back like we just did and go here with a very shorter distance, as you see. Okay, but that's not what I want you to do. I want you to just throw it over the shoulder and reach back there and grab it. Watch what I do. Pull it up and loosen the shoulder as you pull and relax. Pull it down, relax this shoulder and let it pull back as far as you can. So you have this little seesaw action of pulling and holding. Don't force, pull and hold. Pull. Now see how flexible I have here? Watch the difference of the other shoulder. So can you now tell what shoulder has the injury? Look where I am. I can barely lift here, right? I go back and I lift up right where it begins to still hurt. So I don't have near the angle or the flexibility back with this shoulder yet, but I will. Notice happens here. I pull this up and over and I pull this up and hold. Pull it down, pull it up, and relax it. When it goes up, in that position. Relax it, drop it down, drop the trap down, and just hold it in that position. Relax and hold. It's not an exercise as such, right? It is a just pull it and hold. Got it? Now, for the towel, anybody knows who Bruce Lee was. I love Bruce Lee. This is what got me in martial arts. Is you can have all kind of other fun exercises for your shoulder to like strengthen. These are called isometrics, guys. So from here, put your towel out, like the pinkies on the outside. I'm going to pull outward, but I'm not going to pull full strength. Just like 10, 15%, and hold. That's isometrics. Pull and hold. Pull and hold. Pull and hold. So these are all what Bruce Lee made famous. Out to the side, pull and hold. You can try different angles of holding, but this muscle doesn't like a lot of force. Don't pull it very hard. This is the supraspinatus. Most shoulder injuries will have a supraspinatus weakness. Notice the pinky where it is. So pull and hold. Now if you want to keep it continuous tight and roll and hold, you keep continuous isometrics on the shoulders and the forearms and the biceps and the triceps, right? These are great exercises, even to the side. Like, think you're doing like some nunchucks to the side, right? Have fun with these things, guys. There's a million things to do with just a simple towel, see? Down to the out, right? But now I want to change my hands to palm up. Different set of muscle groups, right? So think of going out to the side, which is a muscle called teres minor, right? This is also for your thyroid. So if you're going to take a muscle out to the side, hold, come out a little further and hold. It's a thyroid muscle, okay? Same thing out to the side. Come out to the side and hold, okay? So you're resisting out this way with isometrics. Isometrics means you're holding the muscle and contracting it actually till it begins to cramp and fatigue, right? So there's your isometrics there. Now, what about your pecs? They're part of the same region, right? Go across and push until it stops and contract and hold, right? I was doing this before I filmed for you guys and I got like a cramp in my chest. Just to let you know, you push and hold until the muscles begin to shake and contract, and that's really the true isometric to fatigue if you want to do it right. Those of you beginners, just do it. Feel all these contract, feel your shoulders, and hold, and hold. So from the outside to the inside, guys, you can be a constant workout, never letting the rag or the towel get weak at any time. Notice how I'm keeping a constant contraction. Those of you out there who are actually martial artists watching this, you know what I'm talking about. Now what do? You're done. Maybe some of you have one of these Thera bands. Right? As I try to make it as simple as I can, having household items that you can easily do what with? Isometric holds. Come out to as far as you can. And with the bands, guys, it's a little different. Watch what I do. I come out and I hold. Now slowly let it. It is not an exercise like this. That is not the same gym exercise. It is pulling it out, holding to contraction, and then slowly let it in. Whether you're doing one arm at a time, notice I'm anchoring that elbow in, and slowly letting it in. These are also help with posture. This helps you draw your shoulders back and down. Teres minor, the rhomboids back there in the back, these all help drop the shoulder blades down in the back. Out, and slowly let it in. Same we did a while ago. Out, slowly let it in. Is that supraspinatus again? But what we can do again, take it inside the hand, as such, and you can do your own set of exercises again. Hold and back. Hold and back. And guys, you don't have to be a martial artist to do these things. All you have to do is just have like a little imagination and some motivation. Motivation is from the outside. Inspiration is from the inside. So when you're inspired to do something, it comes from within. Someone has inspired you. People from the outside will motivate us. We'll watch a video or read a book, something will motivate us, but inspiration, guys, has to come from the inside. Many of you know who are watching this video, I had a very traumatic accident back in December, and I was in the bed for 3, almost 4 months, immobilized. These are the things I did to get myself better. Everything I show you and more. As soon as I could begin to move, I began to do all these things again. I did whatever my body allowed me to do. Look at your arms out straight. One pushes down, one pushes up. Keep the contraction. One pushes out. Now if you want to, just go back and forth until you can't hold the contraction anymore. Done. That's with the band. Be creative. Have fun with bands. They're very easy to use. You have a hard time injuring yourself when you use a band, guys. Now, what's next? The very next, I'm going to be very brief because I'm going to make a video later that has more details about breathing. But I want to discuss to you about an internal martial arts, internal practice. Is we can lift the outside all day long, but sometimes it's the inside that makes the most difference. And when you're younger, people don't get this when you're younger. It's only when you become older that you realize how important the internal part of training is. When I teach martial arts, if I have a Qi Gong, a Tai Chi, none of the young guys ever show up. It's always when someone's been around for a while, they understand the importance. I was the same. It took me many years before I started doing Tai Chi or Qi Gong. But those of you who want to practice it, the very beginning, we showed you earlier the 3 basic movements for shoulders. Perfect, right? But now, what about the breath? 2 breaths, the Japanese Qi breath, a very hard internal breath. If you have a lymphatic issue, you're getting this kind of thing going on, it's your lymphatic system. So let's blast it open really quick. Put your hands together. Guys, right over your left. Women, left over the right. It's about polarity. Okay? Now watch. Into the nose, and hear that hard breath. I'm really doing it kind of soft for you guys. I don't want to terrify anybody by the hard breath because it really sounds very dramatic when you do this the proper way. Now, some of you may like it this way. Some of you may like it this way. You decide which feels better for you. Guys, right over left. Women, left over right. Watch again. First chamber. Second chamber. Third chamber is at the eyes. Hold. Three hard breaths. Now what happens is somebody would begin to get really dizzy doing this in the beginning, because when you start blasting open your lymphatic system, forcing blood through areas that's normally not flowing through correctly, you're opening up chambers, all this digestive, lymphatic, meridian, nerve, vascular, all these 5 flows of your body. So the breath will open all these other areas that aren't flowing properly, especially what? Your diaphragm. It's a lymphatic pump. Got it? That's all I want to show you right now, the Qi breath, because that's something, if you guys want to come to the weekend seminars and classes I have, on the weekends once a month we're doing Qigong, we're doing breath techniques and stuff like this, guys. It's for the public, it's for everyone. Next one, the Taoist breath. Taoist breath is what? Belly, chest, throat. Right now I'm using what? Just my throat. So those who want to practice, it looks like this. And I'm doing just the mouth. Now, it's the key thing is don't push out hard with the mouth. That is a fire breath. So as I breathe in with the mouth, the balloon fills. It's almost like you want to punch somebody with your belly. Okay, I'm joking, but the idea is you want to push it out more forcefully. And see how my hand is rolling with this? But up here, what's happening? absolutely nothing. You want your chest to be completely silent. So get control of the chambers, you get control of your body, you get control of your mind, you get control of your life. It's basically in that order. So those you want to spend the practice breathing, practice only that in the mornings or try it before bed to relax your mind, sedate yourself. Next is the chest. Notice this doesn't move. Let your chest rise to the sky. Your ribs should be rolling. As you breathe here, the chest lifts as the ribs roll. Sometimes you have a rib that's stuck, needs to be worked on. And notice I'm not pushing the breath. I'm letting it come out slowly. All right, then the throat. So the throat is already working with the breath. So how should this look to practice the full technique? Watch closely. Notice the flow, the rhythmic flow. Start at the belly. And notice my head comes back a little bit to make the air come all. I'm thinking about breathing all the way to the top of my head, guys. There's this flow. It's like a little wave that happens in the body. And when you get better and better at this, you practice the more details of this breath, you actually open up not the chakras, not these energy centers, chakras here, guys. There's a chakra called the central canal that also spins around through our head, out the bottom here. So like a merry-go-round, those horses has got a post all the way through your body. The center of your body, the central canal, is a chakra that spins, and it is the actually most important chakra you want to learn to turn on. This breath specifically will help that chakra come on and turn. And it's when you start feeling a warm sensation. I call it the wind tunnel. Because when you do it properly, you start feeling the heat, the hot, inside the body begin to warm up. And that is the internal breath heating things up. That is the central canal that's opening. And when this one opens, guys, you feel very different. Your other chakras will all come on instantaneously, spinning the proper direction. But also your biofield, your aura will go out 10 feet plus. Because most important to you is this aura we have, that we expand it. You expand your field. That is your immune system. Your aura or your biofield is your immune system. Practicing Qi Gong daily is the best thing I know to make that expand in your life. The breath and the movements will open up your biofield. Why is that important, Dr. Price? Well, you know this thing called 5G, 6G, 30G, 60G, all this radiation, radio frequencies? The larger your field is, it is an electromagnetic fence. So electromagnetic fence that protects the body from radiation. That's the first thing. Everyone's got a Wi-Fi, TV, cell phones everywhere. The idea is you're protecting yourself from radiation. Radiation greatly affects your vascular system. It can actually, at some point, you can have radiation detach the oxygen molecule from your red blood cells. Remember during the COVID time, people had trouble breathing? There you go. Detaching it. And that was radiation, guys. All right? So the biofield protects you from bacteria, viruses, negative people. All right? So when you have a bigger field, someone who feels in a negative place, they may not feel comfortable being around you. But as you have a bigger field, you actually can change things around you. You can change the energy of a room. You ever felt someone walk into the room, the whole energy changes? People have a strong enough energy, they can do what? They can change the room in a very positive way. They can bring the whole room down with a negative way. You know what I mean by that, right? So you won't be the person that begins to alter your environment by your biofield. You walk into a room and it uplifts the energy. It uplifts people around you. People feel it from you. And anybody who comes within your field and range begins to change their field, guys. This is a whole subject we'll discuss another time. But once again, the Taoist breath, but make no mistake, as you breathe in, don't go, don't breathe out back and forth. That's a fire breath, and that's a completely another talk because that will put you in an altered state. And I tell you, don't try that practice alone on your own unless someone knows what they're doing to teach you the proper way. So guys, there's your upper body and shoulder routine. Several things we talked about today. Practice one at a time and find something that's comfortable for you, find something you enjoy, find something that exhilarates you, get you excited, a little ecstasy, euphoria that you feel after you practice. And if you feel that every day, that is a great way to begin every day. Have a great day, guys. I'll see you next time.